Just 1 second, I'll be with you. New patient consultation. Okay. Hi, sorry about that. So, I understand you're here for a plastic surgery consultation, and I do believe that it's for your nose. Okay, so sorry, I haven't even introduced myself. Sorry. My name is Dr. Ingalls. Nice to meet you. And you are Mr. Harvard. Okay. Okay, so just I'll just ask a few questions about the circumstances and what exactly you're looking for, and basically I'll give you a step-by-step process of what we will do, and what I can do is I can show you what will happen during the procedure if you do decide to go ahead today, and I'll try and lay it out as best I can for you. Okay? Okay, so I can see from looking at your nose it is quite hooked. What you've got is obviously you've got quite a bump just down the bridge of your nose there, and you've also got a little bit of a bulbous tip there as well. Okay, sorry about that, the sun's just coming in the window there. Okay, right, so what you're wanting is you want that bump there flattened down. Okay, so rhinoplasty flattened. Now, how did it come about? Were you born like that, or was it? You told me it was an accident. Right. Okay. So it was an accident at work. Okay. You broke your nose. Hope you get a claimant for that. Okay. Okay. So basically, you broke your nose and you didn't get it put back in place. The hospital just told you to keep it the way it was. Okay. Okay, that's fine. We get a lot of people in who have broken their nose, and they leave it to heal faster, but they don't like the way that it's it makes their nose doesn't suit their face. So we can certainly help you with that. Okay. Right. So what I'll do is I'll take a look at your nose. I'm just going to put these gloves on here. It always helps to be hygienic and stop any transfer of infection or things like that, because I see so many people during the week and things like that, there's a lot of germs and things floating around, so just to be cautious, and because I will be touching around your nose and your face. Alright, okay, so I'll just come round and see you here. Okay. So if you could just turn your head towards me. Okay. Right, so you don't mind if I just touch your face? Right, so, okay, so I've got the large bulbous tip there, and a slight deviation of the nose as well, slight deviation there. Okay, but we should be able to do a fine job of that. You don't have to worry about scarring at all either. The way we do it, when I show you how we set about the procedure in the diagram, I'll draw out for you. We don't go in anywhere around here. What we do is we actually make an incision just between the nostrils there, and we pull this tissue back and go inside there. So there won't be any visible scarring. All you'll be left with is a little cut, a little scar just there, which will be unnoticeable. After that's all healed up, you know, it'll take kind of 4 to 6 weeks to heal, and after that you'll come back in for a post-op consultation, and we'll go from there to see if any other work needs done or anything like that. Now, I can see, right, okay, so that should be absolutely fine for the nose job, for the rhinoplasty procedure. Now, you do also have a little bit just on the bridge of your nose. I don't know if it's a little bit of swelling, or you know, if there's a bit of scar tissue under the nose there from your accident, but it's a little bit deviated and it's a little bit swollen up there. What I can do is I can also reduce that. Okay, and that will also help make your brow line look better as well. Okay. Okay. Yep. Okay. So what I'll do is I'll just grab this pen here, and I'm just going to make a few markings on your face, just down the middle of the nose and along here, and just a few markings around the sides as well. I'll get a picture of that to look over after you leave. The reason that we draw the lines is just so that we can get an idea of where we're going to be doing the work, and we can also use our computer to give us a before and after image. So you know, once you come back in for your next consultation, we can show you what it should look like, kind of a representation of what it should look like when it's all healed. So that's really fancy. Right, okay, so you don't mind if I just go ahead and draw with the pen? Okay. Right, so we're just doing a few lines down the front of your nose. And just on the bridge of your nose there, I'll just put a few dotted lines here, and round the sides of your nose, just do a few lines in as well. Okay, okay, yep, this is looking good. Okay, and just around the tip of your nose there. Just do a few lines here. Okay. Okay, so let's see how it looks. Yeah. Yep. Okay. It's looking good. Just put lines in there. Okay, fantastic. Perfect. Yep. Okay. Alright. Now, what I'll do just now is I'll get a quick picture of your lines there. Alright, I'll just take on the works phone here. Okay. Now, just need to get the camera out here. Okay. Okay. So, Say cheese. You don't have to smile if you don't want to, but just keep a straight face for me. Okay, and just turn your head to the side for me. Yep. Perfect. Okay, and just the other side for me. Okay, and now I just want to get a shot from above your nose. Okay, so if you could just look straight down from it. Alright. Okay. So that's us. Thanks for your patience here. Alright, so these photos will be uploaded straight to my computer. Everything's all connected via the cloud, so all images are shared straight to my laptop, which is excellent. Okay, so if you'd like to take a seat back down, okay, and we'll just show you what will be happening from now on. Alright, so I've just got the picture here. Okay, so I'm just going to add a few notes. Just give me a little minute there. Would you like a drink of water while you're waiting? Yeah, okay. There. Okay, it'll just be a few minutes. Okay, so okay, if you could just confirm your full name for me. Okay, and your date of birth. Okay, and your address. Just the first line of the address, yeah. And the postcode. Okay. Alright. Okay. Okay, payment details we can sort out later. Just need to email the anesthetics team, anesthetist. Set up for procedure at 4 PM tomorrow, provided Mr. Harwood flight to Orient. Alright. Okay, I'll just get these gloves off here. Okay, so I'll just show you quite quickly what we'll be doing. I'll show you a rough indication of what I drew on your face, so I can take pictures. Okay. The surgery that you'll be getting, it's called a rhinoplasty, which is plastic surgery for the nose. Alright. Okay. Alright. There. This is what I'll show you where the lines and things will be drawn, okay, for the procedure. But this is a before, so this is the bump on your nose here. Okay. I'm not the best drawer, but believe me, my plastic surgery makes up for it. And this is an after, so at the moment you've got that bump there. And after you should just have a smooth incline on the nose, as well as a less bulbous tip. Alright. Now I'll come back round just to show you what we'll be doing. Okay. So obviously this is your nose here. Alright, now as I said earlier, what you've got is you've got some swelling at the top here. Okay, just at the top of the bridge of the nose, between the brows. Okay, so what I'll be doing is I've just drawn a few lines here like that. Okay, looks a little bit like whiskers. That just means that it just reminds me to target that area. I don't need to do anything major for there. All I need to do is just make a small incision just in the brow. Okay, and I'll just remove some of the tissue from inside. If there's any scar tissue, I'll remove that, because that's what I think it is in there that's giving you that swelling. Okay, and where you've got the bump, just here. Okay, I've just drawn some lines like that down the side of the face. Okay, now all that means is that bridge of your nose needs thinning out a little bit, so you'll have a thinner, more defined bridge of your nose as well after this is done. And it just means that I need to remember to flatten out that bump as well. Now from here, if you imagine the underside of your nose, okay, and obviously the nostrils are there. Okay, now as I said, what I'll be doing is I'll be making a very small incision just on the tip of the nose there. What I'll do from there is I'll go up and to the back of the nose, which takes me, so I'll be going up here and I'll be coming in around here where the bump is. And what I'll do is, although it does sound quite barbaric and old fashioned, I'll be taking a hammer and chisel to the bone in your nose, and I'll be breaking that bone and reshaping it to give your nose a more defined flat shape. Alright, it does sound quite brutal, but that's the way we do it. Alright, and that's why the healing process takes a little bit of time as well, because you need to wait for those bones to heal together again and fuse. So a small incision in there and go up to the bridge of the nose. So once I've broken those bones and reformed them into a suitable and more desirable shape, I'll come back down to the tip where it's bulbous, so you've got the bulbous tip there, and I'll just remove a little bit of the cartilage from this area. Alright, and then that means that once I stitch that up, it won't be quite as round anymore. It'll be more kind of a pointed shape like that. Okay, so that'll be a lot more defined as well, looking from the bottom, and also looking from here. So your nose will have a more kind of sculpted, defined shape. It'll be a lot smoother, and it'll have more of a point rather than that bulbous tip. Okay. Alright. Okay. So I'll just squeeze back in here. is I'll just show you some befores and afters, okay, of some work that I personally have done. Okay, I just need to access the files here. Okay. There are most of the cases I work with, especially in men, are very similar to yourself. Alright. Now this is just one of them here as soon as I load up the picture. Okay. Now that is one of my previous patients there. Alright. You can see the before he had that big bump on his nose, similar to yourself, and afterwards you can see he's got a lovely nose. It's flat, still a little bit of a bulbous tip, but he wasn't too bothered about that. He just wanted mainly that bump taken away. Okay, so I mean that's just one example of my work. As well as doing those jobs, I do a number of other plastic surgery procedures. If you're interested in anything else, alright, just let me know. And what I'll do is I'll just give you my details. Okay. Alright, so apart from that, do you have any other questions, any other queries or worries about the procedure at all? Okay, the aftercare, what we do is once we've finished the procedure, what we do is we pack your nostrils with gauze. Okay, and what that does is that stops, because you will have a bit of bleeding and a bit of swelling, so that will just stop the nosebleeds and it will help with the heal as well. When you come back to see us, what we do is we'll just remove those and it will take all the dried blood and things out with it, okay, and it should leave the inside of your nostrils completely healed. Alright. Apart from that, you don't need to do any of the aftercare, it's just making sure not to remove the packing, the gauze packing before you see myself or one of my team. Right, okay, yeah, I'll get you a wipe so that you can remove the pen. I know it probably feels a bit silly having a pen on your face. Yep. Okay, bear with me a second, okay, yeah. Do you have any other questions? Okay, and you're quite happy to go ahead with this? Okay, excellent. Okay, so would you like me to go ahead and book you in for tomorrow at 4 PM? We have a slot then, and the anaesthetist will be able to help you out then as well. Alright, so everything's sorted here. Okay, brilliant. Now, I'll just need to set up your payment details. It won't be myself that takes them, it'll be the receptionist in the main hall, okay? So just give your details to her. So, confirmation of procedure for patient Mr. Hart. Okay. Right. So that's your booked in, and if there's nothing else, then we will see you tomorrow. Alright, okay. Well, thank you very much for coming in. Okay, we'll take that glass from me. And we will see you tomorrow at 4 o'clock.